Two. All right, it's time to talk with our featured guest, Dr. Mateo Vidales. Mateo, how's it going, man?
Pretty good. Pretty good. Thanks for having me.
That's good, man. Where are you located?
I'm in Lakeland, Florida. So
Okay,
it's between Tampa and Orlando.
nice. Okay, how'd you come about to be there?
I was working in Orlando and I just saw an opportunity in the Lakeland area. It was too good to pass up. So I just jumped on it and bought a practice.
Nice. Okay, man. So then tell us a little bit more. Tell us a little bit about your past, your present. How'd you get to where you are today?
Um, like dental wise,
Mhm.
so I graduated 2018 from Nova. I worked about a year in Orlando. Then a year out, I decided to, go, do my own thing.
Mhm.
Um, it was pretty hard at first. At first, it was bought a practice that wasn't doing so well, and had to really turn it around. Now we're doing pretty good. I have an associate, and I'm hoping to close on a second practice, hopefully before the end of the month.
Really?
Yeah.
Why wasn't it doing so good at the beginning?
Just it wasn't managed well. Um, the doctor there, uh, he was an associate for some absentee owners, so he just was there to collect his daily rate, and he just didn't really care. So,
Mm,
and then there was a lot of treatment that just wasn't getting done, and just a lot of inefficiencies.
yeah, yeah. Okay, man. When you graduated from dental school, has this always been a thing? Like, oh man, I want to own a practice, or was it more like, nah, it just kind of stumbled upon it?
Um, I mean, at some point, I knew I was probably gonna do it. Um, I was just, you know, during dental school, I, I was looking at what options could get me to where I wanted to be the quickest,
Hmm.
and ownership was really the only route.
Where do you want to be the quickest?
I mean, just to be, financially stable, paid off loans, all that good stuff.
Yeah. Do you still have like student loans?
Yeah, yeah,
Gotcha, gotcha. Okay.
definitely.
So then you graduated, you said, I'm gonna do my own practice eventually, right? How long were you associating for before you owned your own practice?
So a year.
A year?
Mhm.
What did you like from your associateships and what did you not
um, that I liked. It let me, being an associate, let me not worry about any of the management parts of running a dental practice. I could just focus on getting better at the dentistry, which is, really what you need those first few months out of school. Um, because it's really difficult to manage plus, get better clinically. Um, and it's not until recently that that I'm really confident clinically.
like?
Whereas I just don't have to worry about that. Whereas the first year out, I was really worrying about clinical outcomes. You know, how long is it going to take me to do this procedure? Things like that. Now I really don't worry about that. I know that I've done it so many times that it's not even a second. I don't give it a second thought. Um, Now I can focus on managing and learning how to manage.
Yeah. Is that to you? Do you feel like, do you ever think sometimes, Mattel, like, man, I kind of wish I could just go back and just get that paycheck and then that's
Yeah,
it?
yeah, sometimes, but it's it's it once once you buy your own practice, it's not something that can really be undone easily.
Mhm.
It is nice to just do the dentistry and go home and not have to worry about it. um the thing about being an owner is like you're an owner 24/7. If something goes wrong, you're there. But I've been lucky enough to step back a little bit at clinically. So I hired an associate a few months ago.
Mhm.
They've taken most of the clinical responsibilities, and so that's let me do a lot more management and a lot more just figuring out best practices uh, to run the practice the most as efficient as possible.
Yeah. When did you start your first practice?
So I bought it in October 2019.
Oh man. How did COVID hit?
It it was pretty tough. So 2019, October 2019, I was just getting my feet on the ground.
Mhm.
I just bought it. And then of course, like a few months later, March 2020, the world stopped. That was really scary because obviously I didn't know what to do. I
Mhm.
mean, nobody knew what to do, but as a new business owner, you're really scared, and how am I going to pay my employees? You don't really have that much in cash reserves. Um, but we got past it, and now knowing that I could get past something like that, a lot of the other challenges are just not as difficult, or they're that was something that could have ended my practice really quick.
Yeah. Looking
But
back, what did you feel like you did really, really well to overcome that? Like what are you doing now just in case, I don't know, like, oh my God, there's another variant and everything shut down again or something like that.
um, being as lean as possible, like I never really, that's something that helped us through that. um, but we never really had a choice in the beginning. Like we had to be lean in order to survive, and we just kind of kept that going. um, lean as in, you know personnel wise, having what just what's necessary.
Mhm.
um, Keeping our expenses reasonable, and of course that translates to higher profits. If you're very productive and you're very lean, that makes you very profitable. um, but I am kind of wondering how other practices who aren't, who don't try to be as lean, how they were surviving.
Yeah.
um, you know we we were having a tough time even though our expenses were like really low. So I'm just, maybe
You're
maybe they
wondering.
were more established practice. They had more cash reserves. That's the only reasonable explanation for that, I think.
How lean, how lean are you right now? Like how lean were you compared to now?
Um, so our overhead, like overhead to profit,
Mhm.
um, it was. I mean, now with the associate, it's not as good as it was. When I was practicing, I was probably at like 55. Now it's a little higher, probably in the 60s. Uh, but that's like one of my biggest KPI that I look for. Try to keep expenses under control.
Gotcha. Okay. So then, I mean, you think about it, Mateo, you got an associate right now. You got an associate because you were doing another practice, or you got an associate and you're like, I'm going to do another practice now.
Um, I got an associate, so I know that my time in dentistry is kind of limited. I have some shoulder issues.
Oh,
I mean, I need to get it fixed. I just don't know when it's, occasionally it acts up. Um, but I know that I'm probably not always going to be able to practice. So I need to kind of have a contingency there, to not be reliant on my own two hands to be able to produce. So that's kind of like one of the main motivators, um, to kind of growing.
mhm.
So I mean, I still practice, but just I don't practice as much as I used to.
Yeah.
Um, Yeah.
What happened, if you don't mind me asking, like to your shoulder?
Um, about 10 years ago, I just had a sports injury. I was playing racquetball. I got too competitive. I don't even play racquetball. um, it was one of those things where just uh, and and then it's been affecting me for ever since it happened. I dislocated my shoulder like 10 times.
Oh,
It's never one of those like in the movies where you can just pop it back in. I always have to like go to the hospital. So it's not fun.
yeah, yeah. That's good, man. You have a little bit of insight. You're like, I mean, you have foresight. You're like trying to, you know what I mean? Make sure you have is this it? You're like, I just want two practices, that's it, or do you have like a plan in mind?
The plan is, you know, after getting this one up to speed and seeing what it's capable of, I think I can do it again with the second practice. And I mean, really, I don't know what the limit is. I don't want to limit myself to, this is this is the goal. I mean, I have a goal where I want to the my practice is to produce X amount so that I can be comfortable.
Mm-hmm.
But I don't have a set number of practices that I want to get to. um, I mean, I have a minimum, I want at least 4, but
Oh,
after that, I'm sure I'll be able to do more.
yeah. If you hit 4, then the rest of it's gonna be the second practice that you was it acquired or is it a build out, like a startup?
So it's going to be an acquisition.
How'd you find this? How'd you find both of them?
Brokers. So I just start talking to banks, and then banks tell me what brokers are in the area. In Florida, it's Doctor's Choice, it's Henry Schein, AFCO. There's a few like individual people that are buying and selling dental practices. But yeah, those are the big three.
If you don't mind me asking, what were like the terms of your first acquisition? Like, how do you know for anybody thinking to do an acquisition, what's like the due diligence?
It's a, I mean, it depends on what you're looking for, um, because you can't always just pick and choose where your practice is. I always say you kind of have to go to the opportunity. It's
Mm-hmm.
not going to be like, oh, I really want to practice in, say, Orlando, and the perfect practice is just going to pop up there. The chances of that happening are pretty low. Not impossible, but low.
Mm-hmm.
Um, so you either have to, do a startup, make, you know, make your practice to what you want, or take an acquisition at a place where you know you is not ideal to you, or it could be ideal to you, and then make that work. I kind of chose that one. I didn't want to be in Lakeland, but the opportunity just was too good. Now the second practice is going to be in Tampa, which I is going to be a little bit better, I
Yeah.
think. But Lakeland is like semi-rural, so it's you get a mixture of like uh, blue collar patients. So it's a lot of oral surgery, and a lot of just dentures.
Yeah. What's a too good opportunity? Why was this opportunity too good?
What was it too good? The price of it to what it could be doing. Um, I look for practices that are underperforming, like obviously underperforming. I don't look for the $1 million practices, uh, because those practices are difficult to add value to,
Mm,
unless your skill set is like is really wide. Unless you're really good at, say, ortho, or you could get patients to say yes to Invisalign cases all day long, or you do all on fours.
mhm.
There's not a lot that you can add to $1 million practices. Um, what I look for is those, practices with, good bones, um, uh, things that are underperforming, usually under 500,
Okay.
um, where it's been mismanaged. So I
Gotcha.
have the opportunity to come in, manage a little bit better, but increase the production, increase the value of the practice.
Hmm. Okay, man, that's good. When you're looking to see if it's not $1 million practice, what, or actually better question is like when you're asking to manage it, to better manage it, do you ever have to like this acquisition that you just the first one, was it like, all right, team, like everybody in there, either you follow this or you're out, you know what I mean? Or how did you do that?
So for
Yeah.
this, so for the first one, it was like a lot of trial and error because I honestly I didn't know what I was doing. They don't teach you how to hire in dental school. They don't teach you what to look for in employees. So it was a lot of figuring it out as I went along. I did have to let a few people go because they wouldn't, they had a set way of doing things and they just did not want to do it the way that I wanted them to do it.
Mhm.
So I had to let them go. There's some people that adapted, which was great. I have two employees from the original one that stayed with me, and they've been great. Um, but everybody else had to be changed out. So
Yeah.
yeah. So what they don't tell you is like when you buy a practice, you also buy a lot of the problems and a lot of the previous drama that it had and all
Mhm.
that. So sometimes you just have to clean house and you start fresh.
Yeah.
So supposedly, when you buy a practice, you're buying the patients and you're buying the supposed systems that are there that are making it successful. But sometimes it's not the case. You don't get good systems and you don't get good patients. But
Was
you
that
got
the
to make
case for you? Like you didn't get
I actually the patients were pretty good, but it was just everything. The systems were not there. Everything was kind of a mess.
Mhm.
The old doctor was it was kind of it was a mess because the old doctor, the one that was an associate, was the original owner of that practice, but he lost it through a bankruptcy, and then the new owners hired him to run it. You
Gotcha.
follow?
Yeah, yeah, yeah.
So then he basically drove that practice into the ground twice, and then that's when I came in and I scooped it up.
Yeah, but that's what you're looking for, right? You're looking for like the
Yeah.
underperforming type of practices.
Yep.
How did you
That's not
want
to say that. Oh, I'm sorry. Go ahead.
no, what were you gonna say?
That's not to say that like $1 million practices can't be a good buy. Like they
Mhm.
can definitely be a good buy. Um, if you're looking for cash flow, like immediate cash flow, and if you can step into the previous doctor's role, yeah, it can definitely be a good deal. I'm not saying that it can't be. It's just like my blueprint is, to take these underperforming practices and give them value. So I took a whatever $300,000 practice and now it's doing 1.2, and I created that value, from what it was worth when I bought it to what it's worth if I sell it now, right?
Mhm.
Whereas if I bought $1 million practice, to get it to 2 million is going to be a little bit more difficult because it already has good systems in place. It already has things that work well.
Yeah. Yeah, it would cause like you to do more upgrades on like your clinical, you know what I mean? Be leaner, do a lot more in details. I get you. I get you. When it
It's like
came to the uh-huh.
like I said, it's not necessarily Like, I don't want to discourage people from not looking at $1 million practices. It can definitely be a good deal. You just have to make sure it's right for you.
Yeah. Okay. When it came to the employees, where you said like, oh man, they didn't do what I wanted them to do, so like I let them go, right? What was that?
Was one.
Like, what did you want them to do?
So one of the biggest issues when I started was the people who were running the front desk were scheduling to how the back wanted. Like
Mm.
the assistant said, hey, don't put too many patients here. It's, it's too much, or only do it this way. Like they were there from a long time before I came in. So they kind of had a system. So when I came in, I told them that I wanted things differently. Like, yes, I wanted more patients, in a shorter amount of time.
Mm-hmm.
And they would go behind my back and tell them, just keep it the way it was, keep it the way it was. And I'm like, what's going on? Why aren't things, why isn't it being scheduled according to how I was telling you?
Mm-hmm.
And so they just weren't doing it. So, I after telling them a few times, I can only beg them so much.
Yeah.
And that's what I learned, early on. It's not, you're not trying, they have to fit your vision. They have to be able to go along with what you're trying to accomplish, or else they're doing you a disservice.
Mm-hmm.
And then they're not happy. And then, that's, and it shows that they're not happy, and it makes your life harder. So, sometimes it's better to part ways.
Yeah. Did it get to the point, Mattel, where you were like walking into the practice and you're like, oh my gosh, I
Yeah.
do this? You
Yep.
got to that?
Yeah. I would walk in, I'm like, I don't want to deal with this person. That's kind of when I knew they had to go.
Mm-hmm. Yeah. How do you do that? How do you let them go? Like, how does that conversation go?
It's not my favorite. So, I mean, before I actually do it, I tell them a few times that, hey, please fix X, Y, and Z. I really need this to work.
Mm-hmm.
I want you to work. I hired you for a reason. I tell them, yeah, hey, I want it to work out. I kind of give them the precursor, and then I ask them, again, hey, I asked you to do this. Why isn't it working? Or why aren't you doing what I said? And then, if they keep doing it, then I tell them, hey, this isn't being done like I asked you to, and I've asked you a few times, and for this reason, I have to, let you go.
Yeah. Were
So
they
it's not
like,
like I just, hey, I don't like you, leave.
yeah.
Because it's difficult to train new employees, and difficult to find employees, especially in like today's job market.
Mm-hmm.
So hiring and training is, is difficult. It decreases production, really. If I have to fire someone now, it would definitely decrease production, because I'd have to introduce someone to my systems and wait for them to get up to speed until, and then in that time we're losing that production. So it's
That's
tough.
true. That's true. You're right. And then the time it takes to find that person and all that stuff. It's interesting that we're at that time right now. You know what I mean? Where we have to really think about like, even if, I mean, have you ever done that where you're like, how much does this person really suck? Could I just manage a little bit longer with them? You know what I mean?
Sometimes you know in the back of your mind that you have to replace them, and you have to be looking. um it and sometimes it's better to just cut them, and then just suffer that suffer for a little bit of time until you find somebody else. It really depends on the situation.
Yeah. That's true.
So
That's true. I think you're right. It depends on the situation and like how everything's coming along. Okay,
yeah.
so then with all this, I kind of want to dive in a little bit of your practice. What kind of practice do you have? Is it just fee for service, PPOs? You see all kind of people, all kind of insurances, or?
So we see, I want to say like 35% fee for service, and then the rest is PPO. We do take some Medicare, just because there's a certain program that's pretty big in this area, that just it drives. It's for I don't know. It's promoted pretty heavily here, and it's a lot of covered services for senior citizens, and we don't mind doing a lot of dentures and taking out teeth. So,
Got you. That's good. That's good. And then how many employees do you have?
8.
How'd you find them all?
How did I find them? Like I said, 2 came with the practice, and then Indeed, and then friends of the current employees that are there, or people that they knew from previous practices. You know, they called them up and said, "Hey, we're looking for someone. You know, it's a good environment. We'll offer you X, Y, and Z. You know, come on over." And yeah,
And they came over. That's good, man. And then roughly, if you can give me like a good range or as specific as you want to be, like what's production and collection looking like for you?
daily or monthly,
Let's do
or
monthly.
monthly. So monthly, we're looking at. So the past few months, it was right under 100. For collections. For production, it was probably like 110 to 115. So we're not at 100% collection yet. That's something that I'm striving for. Well, I mean, you'll never get to 100%, but a lot closer to 100%. Just the timing things right with insurance, and with this, this Medicare program that I told you is a little bit tricky. They're asking for pre-approvals for every patient, so things get there's a lag to it. There's a lag between when we do the work and when we get paid.
Yeah, man, that's good. That's still fantastic. I mean, and you're lean. You know what I mean? How many ops do you have?
We have 7.
Wow, man. What, I guess from when you started to now, what systems did you implement where you're like, I'm so proud of this system that I made? Like it's amazing.
I can't. That's a good question. I don't really have an answer to that. Everything was kind of, it slowly got better. It wasn't just from one day to another that it, I just implemented something and, world changing. It was more of a, hey, we're not doing this so great. Let's find a different way to do it. Just like small corrections here and there. But I can't really point to one particular system where it's, great.
Yeah. Where do you feel like you had the most struggle with changing, or like you feel like I had to keep pivoting for that?
To keep pivoting,
to get it right, or to get it close to right?
to get it like what system I had to change.
Like not so much, maybe not a system, but more like, man, like, how you said you kept changing or you kept adding small things here and there, small things and changing. Where did you feel like you're like, we're still not getting it? Like our AR is still not happening. It's still not happening. Or like our no shows are why is it still sucking?
I mean, nothing, we still struggle with all of that. We're still, trying to perfect all of those things. we still have issues with, like I said, no show, like you said, no shows, AR, just like a big one is employees, employees kind of knowing what their jobs are basically, and just having them be responsible for for their own work, as in not having me micromanage them. I think something that I did that I liked, that had a good impact, was having a bonus structure where they felt like if the office does well, they do well. So everyone is motivated to keep things lean for one, and to have the office produce as much as possible. So my structure for them is they get a certain percentage, they split a certain percentage of our collections. So it's like 1.5%. It's not to 2%. It's not like huge, but still it keeps them motivated.
Yeah, that's good. I like that. The bonus structure for them, for every single team member.
Hygiene has their separate bonus system.
How does theirs look? Hygiene.
So theirs is there's a formula. It's three times their hourly rate is what their goal is. Anything above their goal, they get 13% of that.
Wow. Do they hit it quite often?
Yeah.
Nice. That's good motivation. Like,
yeah,
to let them know that. Your associate, does he have anything like that or no?
No, just he has a percentage of collections.
Gotcha. Okay, man, that's good. And then how many new patients are you getting right now monthly?
Monthly, that's a good question. I have to check. We're looking at, I want to say about 50 to, some months are better than others. I want to 50 to 60.
Nice, man. What are you doing
I have to
for?
check the most recent ones, honestly.
That's okay. What are you doing for marketing and advertising?
For marketing, the biggest one is word of mouth. It, that's the best one. It's the cheapest one and the most effective. You can't really beat internal marketing.
Yeah.
Google reviews are huge. Social proof, really. There's a lot of patients that come in and say, "Hey, I was looking at dentists in the area. You had the best reviews. You had the most and the best reviews." So I really urge people to get that up if they're lacking there.
Yeah.
And then one of the software that we use, the practice management software, after the appointment ends, it sends a review link automatically. So that's pretty, pretty effective to get our Google reviews up.
What practice management software do you use?
We use one called Tab 32. I have a love-hate relationship with it. It's sometimes it causes a lot of problems.
Really? Like what problems?
So when we first transferred everything over from EagleSoft, it just really, it didn't transfer anything over right. Like all patient accounts were wrong. We'd have to go like account by account to fix them, make sure that they didn't like when we transferred everything over, it just gave us a number. It didn't say if it was that they owed or that they had a credit for, or it didn't tell us anything. It just gave us like a number. We'd have to go back and find out what exactly that number meant. That was pretty tough. It's a really new practice management software. So we're trying to be patient with it, but it causes a lot of headaches.
Yeah, I was gonna ask you, like, I know like there's a lot of cloud ones out there, but why, or more and more, right? Like, why did you decide to go with Tab 32?
Um, Cost.
How much does it
So
cost?
I think right now so we had got it when they really first came out with it. Where we paid, I think it was like 3,700 for the year, which goes up to like 300 something a month.
Hmm.
But I think now it's like they're charging five something a month for it. And honestly, I don't know if I would use it at that price.
Yeah.
So when our contract is up, we'll see where things land and see if we continue to use them.
Yeah. Cause that'll be like changing your whole central nervous system, like again, you know?
It is, yeah. Oh man, changing systems is a huge pain in the ass.
I know.
Um,
Man.
but
So
sometimes
no, I was gonna say, so
it's
hopefully it's
best.
like an easy transition, whoever, if you decide to change it up or something like that.
Yeah, it's not a decision I take lightly.
Yeah.
It's a tough one.
Man.
I know
Okay.
some of the other good ones are like Carestack. That's another one I was really looking into. So yeah, if Tab 32 doesn't get it together, our contract is up within the next few months, so
Yeah.
I'll have to think about it.
Yeah. I mean, not to plug it in or anything like that, but Carestack does sponsor the podcast. So you will
Oh,
get
do
it.
they? Oh, what a
Yeah.
coincidence.
They get like a really good
No,
listeners get a good
they're
deal.
not bad. Like I, I was at the practice where they first implemented Carestack. Like the Carestack headquarters is right across the parking lot from the practice that I was at
Hmm.
in Orlando, Florida. So I was in a practice called Celebration Dental Group,
Mm-hmm.
and right across the street was the building for Carestack. So the previous owner of Celebration Dental Group is one of the main investors in Carestack.
Oh, snap. I didn't even know that. Man, good stuff. Yeah, man.
Yeah,
If you ever want.
he was an orthodontist, um, but now he's doing the
Carestack.
practice management thing. Yeah,
Yeah.
a lot of things in real estate, and he's a smart guy.
Yeah. 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 He has a couple islands somewhere, man.
Yeah, definitely,
Yeah. Yeah.
definitely Couple Islands.
That's good, man. So then what's been, would you say, your best ROI throughout your all of this actually?
Best ROI, um, treatment plan acceptance is pretty big. Um, getting like a wide range of clinical skills, implants,
Mm-hmm.
are pretty big. I think that's probably treatment plan, I would say probably more so than implants, because that's something that you talk to like every patient, and then you there's only so many implants that people need really.
Mm-hmm.
But if you can convert a higher percentage of patients, then you're going to be better off.
Yeah. Do you like, does your team did they get some type of special training or something like that from the treatment, or no, you just made it happen?
No, it's trial and error, really. I think what really helps is, walking them through what they need and why they need it,
Mm-hmm.
and just kind of showing them that you're not just there to try to take their money. That, hey, this is like this. We can try to fix it this way. Um, giving them the options, and kind of talking to them like you have their best interest at heart.
Mm-hmm.
Um, and they, most people have a good, like, bullshit meter. They can tell when they're being, played, really. So
Yeah.
if you generally think that, that you're doing what's best for them, then they can feel that, and they're more receptive to doing treatment.
Yeah. Do you show photos and everything like that or no?
Yep. Yep. We show
Uh,
photos. Um, what else do we do? I mean, more so, I give them a mirror. Like, I give them a mirror. I'm like, hey, look at this tooth.
mhm.
That, so that they're kind of like, they're forced to look at it. Um, and then, yeah, like I said, it's been, over time, treatment acceptance has gone up, and
Yeah.
things have been good.
That's good, man. Throughout this process, from the moment you, I guess, sign that you're gonna own it till today, what do you feel has been your biggest struggles, fail, or pitfalls?
Managing, um, no, like I said, no one teaches you how to manage. No one teaches you how to hire employees, how to deal with employees. Um, HR is like always a problem.
Mhm.
Um, that's not to say that, I don't like my employees. Like, I think they're great, but everyone has their own life and their own struggles, and to be understanding of them while trying to get them to do what they need to do is tricky. Um, but with employees, it's always something. Like, one day my dog sister's cat is sick. I got to take him to the vet. It's always something.
What do you do
Um,
in scenarios like that when you feel like it's like that is so really like your dog, sister's cat, like something like that, Like what do you do?
uh, I mean, I try to. It's depends on every situation, but I can kind of tell uh, when they're kind of trying to pull one over. Luckily, it doesn't really happen much, and I've gotten rid of the employees who do that.
Mhm.
Um, but with previous employees, I kind of I showed my current employees, like, hey, this person was always calling out and wasn't there, and I kind of showed them that it affected everyone else. Like, the day when this person is not here, everyone has to work twice as hard to make up for that person not being there. So I
Smart.
tell them, like, hey, you not being here and you not doing what you have to do affects everybody.
Yeah.
So they kind of buy into the team. At least I
Yeah.
hope. At least that's what I'm getting at.
No, I'm writing that down. That's really smart. Like showing the team members, like, hey, look, this is what happens when Billy is always sick because of his cat, or like gone because of his cat, right? Like,
Like,
y'all need to talk to Billy too, kind of deal.
exactly, and it's kind of a little bit of the peer pressure from the rest of the staff. Like, hey, you better be on it, or hey, you got to do what everyone needs you to do.
Yeah. Yeah. That's smart. One of the last questions I want to ask you, Mateo, is how is all of this affecting your personal life? Like, if for anybody thinking, like, man, I want to do an acquisition, make money, you know what I mean? Do all this stuff. But like, personally, how is it affecting you?
What do you think personally? Like,
Like, right now, we've been talking about business a lot, right? Like, the business, the practice, and everything like that. So, there's that other side of your life, right? Where you're like, I have a great personal life. Or is it like, what?
what other side of my life? This is it.
You're like, this is everything, man. Uh, like, do you
um,
feel like you know what I mean, right? Like, you have time for yourself or kids or anything like that, or how does it affect you?
so I don't have a family right now. That's not to say that I don't want one in the future.
Mhm.
I can see how it would be difficult to do this with with kids and a family. It it does take up a lot of time, but I like it a lot. It's 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 what I've put my heart and soul into. I'm I like to see it do well. Um, as far as personal life, I did put that on. I had to make sacrifices in my personal life. Like I didn't want to move to Lakeland, but
Mhm.
I ended up moving to Lakeland because the opportunity. Um, but as far as I, it can be done. It can definitely be done. You don't really have to sacrifice your personal life that much. Um, Especially if you have a partner who's on board and who's like shares the same goal. That'd be really helpful. Um, but no, I mean, I'm pretty happy with my personal life. I'm hopefully moving to Tampa. I'll have a little bit more things to do there. And now that I'm not practicing as much clinically, uh, I have a little bit more time, to do things that I like.
Yeah.
Um, but I know that's kind of going to go away as Tampa starts, as the deal closes, and I have to get that going.
Yeah. How far is Tampa from Lakeland?
It's about 35 minutes, but the practices are about 45 minutes apart. So hopefully I want to live somewhere in the middle.
Gotcha. In the middle, what would that be like? That's still, is that city or rural or?
Yeah, that's still city.
Okay.
Um, so I'd be like the Brandon area. I don't know, where are you located? You're in the Pacific.
Yeah. LA. So Los
LA.
Angeles.
Oh
Yeah.
yeah, I'm talking about things like where they are.
I know. Yeah. I know where Orlando's at, but and some other places around there because other practices talk to me about it. But other than that, I mean, I've never heard of Lakeland. So
Yeah, a lot of people exactly exactly why I didn't want to move here. Uh,
but that's good, man. I'm happy. I'm happy that it's going good for you right now. Hopefully, next time we talk on the podcast, because I'll probably talk before after that. But I mean, like on the podcast, you can be like on your fifth practice, man, and you're like, Michael, I'm just like cake now. This is DSOs and
possibly, or I mean, you never know what life has in store. I could be happy at two practices, three practices. I honestly I couldn't tell you,
yeah.
but we'll see what happens.
That's good, man. So, guys, if y'all have any questions or concerns, please feel free to reach out to Mateo. Mateo, if they do have any questions or concerns, where can they find you?
Sure. Instagram at Mateo Vid.
All right. That's it. That's the only one.
Yeah, that's don't talk to me.
Don't talk to me
Um,
after that.
yeah, that's the one I check the most.
All right. Awesome. So, guys, that's going to be in the show notes below, Mateo's Instagram. And Mateo, thank you so much for being with us, man. It was a pleasure. And we'll hear from you
Thanks
soon.
for having me, man. I appreciate it.